Living in South Florida, you're threatened with hurricanes all the time. But the pandemic is nothing even close to a hurricane. A hurricane is a one-day event, maybe 2 days disruption. But a pandemic, we've been with it since March of this year. And when it hit the peak in July and August, we had more positive COVID patients in our healthcare system than any other healthcare system here in South Florida. It was like a battlefield.
There were a lot of unknowns and a lot of fear, and as a department leader, one of the things we have to do is suppress that fear and build a system and figure out how to get the job done safely, which is what we did.
The TeamHealth Response to COVID-19 started early on in January, and we started this emerging infectious disease Taskforce, and we brought together national and international experts that all work under TeamHealth. We started outlining what are the things that we're going to have to deal with, and we started getting up to speed on what the virus was and how we would respond clinically. So we started communicating that out broadly across the organization.
Our best partners are the ones that challenge us, with the highest levels of commitment to quality and to safety. They challenge us to act. They challenge us to make things happen. And the Memorial Health System has done just that. And so combined with the fantastic leadership that they have and the leaders that we have within our system, we've been able to accomplish things that really are differentiated from things we can accomplish in other places around the country.
So this pandemic has been, obviously devastating for all of us. It's just a situation that we've never dealt with before. One of the things that I really appreciate is the team that we have of healthcare professionals to be able to take care of the people in this pandemic. From the team health perspective, we have leadership in our emergency departments. We have leadership with our hospitalist program that has truly been the backbone of taking care of the patients from the pandemic.
Now we're in a different world than we were just a few weeks ago. If you combine Broward and Miami-Dade, again, that's pretty close to 50% of the state's total number of cases.
Back in March, we started having probably around, I will say 10 to 20 patients in the system at the beginning of the wave. Very quickly, you will start duplicating every couple of days until we reached a summit of around 180 admitted patients from Memorial Healthcare System.
One of the biggest issues is really trying to keep the general population safe from COVID-19 patients. Memorial and all of our hospitals did a great job of building isolation areas upstairs within our ICU with separate ventilation systems and trying to make sure that these patients are segregated and cared for in areas that don't pose a risk to our general patient population.
When the second wave hit, we started seeing numbers in the 600s around the system for patients admitted into regular units and up to 100 and more for the ICU. So those kind of numbers really strained the system. In coordination with Memorial, we were able to develop a good strategy to make sure that every patient received outstanding care.
One of the things that really helped the healthcare system and TeamHealth is just the incredible amount of communication on a regular basis. We were in meetings day in and day out, 7 days a week, assessing the situation and making recommendations and trying to manage all the moving parts.
One of the great decisions that the system took as the epidemic grew bigger and bigger, it was decided that we will put most of our COVID patients at Pembroke. We also developed treatment protocols and workflow protocols specifically for Pembroke. And through that, we know that standardization always leads to better care.
During the second wave, we could not manage the volume with just physicians who were in the PRN pool. We needed that extra support from TeamHealth to care for those patients.
We have one of the most complex recruiting infrastructures in the industry. We have the ability to redeploy clinical personnel from one location to another in support of situations like a pandemic increase in patient volumes.
We were able to basically add somewhere between 18 to 22 FTEs, full-time equivalents, in a very, very short period of time. We're talking weeks.
Having the resources come from the outside to help us supplement the staff gave me a peace of mind, knowing that we were doing everything possible. I mean, we were going through steps that nobody had ever done before.
We had a lot of new technology that we utilized in the health within the COVID units. We had a telemedicine platform where I was able to, by using an iPad that was hardwired at patient's bedside, to do a virtual visit with the patient after I saw them in the COVID unit. By doing so, we were able to really preserve PPE, minimize exposure for our patients.
So much of it is identifying who has this disease so that they don't spread it to others. And we have been so involved from the very beginning in helping to test the patients in the community. We had the largest testing site in the state of Florida. That really made a huge difference.
At Memorial Regional Hospital, build some ties with the nursing homes and ALFs in our catchment area to track patients that come from these facilities to determine, which facilities had COVID active in their facilities. And then once we identified these facilities, we were able to go out with our teams to help them cohort patients and build safe environments for their patients there, who are the most vulnerable patients in our community.
This outreach expanded throughout our community to all 6 of our hospitals. Each hospital took responsibility for the long-term care facilities within the distance of their hospitals. We were able to really tamp down the virus in these communities. It was a proactive approach. It kept people safe, it kept them alive, and it's something that I'm extraordinarily proud of.
You have to set a tone that motivates people to actually act and make things happen. Aurelio Fernandez has done a great job of that. The memorials have that throughout their culture. That's permeated our team, and it's empowered us to do things that really make an impact.
I don't think I've been more proud as I have been in these last few months to just see what people have sacrificed for themselves and what they've been able to do for the community.
Memorial Health System absolutely distinguished themselves as that world-class organization that was uniquely able and capable of responding to that crisis. They were on point, very focused on the patient and the clinician, and the results speak for themselves.
The nature of emergency medicine is uncertainty, and that's what attracted a lot of us to it. But we're all living right now with a new kind of uncertainty because of COVID. This is the first time ever that the doctors and nurses and x-ray techs and unit secretaries and everybody have put their own life at risk in a big way. And more importantly, the lives and health of their families. I think it calls on a real dedication to the work. This work will define all of us for a very long time.